But with supplements, it can be easy to get too much. A mild surplus can reduce levels of zinc, for example, which is another essential mineral. It can also upset our digestive system. Worse still, high doses of iron are dangerous and can lead to serious organ damage. So as with calcium, the safest approach to iron for most people is to get adequate amounts from our diet. Adult men need about 8 milligrams a day, and women need about 18 until they reach menopause. The easiest form of iron to digest and absorb is from heme sources, so animal sources. Iron is found in plants too, but the form isn't particularly well absorbed, so it is found in leafy green vegetables, white beans and lentils, but we might just need to raise our intakes a bit more to reach our iron targets. Now, of course, there is nuance to this, and some people do need to take iron supplements, and I do prescribe iron sometimes in my clinic. For example, pregnant women, or for those who have heavy periods, or for people with certain digestive problems, they might need supplements, but it's always smart to use iron supplements at a doctor's recommendation and under supervision. Next, let's talk about a popular antioxidant. It's found naturally in vegetable oils, nuts, seeds, and leafy green vegetables like spinach. It's claimed that it can increase lifespan. It's particularly active in protecting cell membranes. It's also been claimed to prevent cancer and heart disease. And for all of these reasons, supplement manufacturers have been encouraging people to increase their intake of this vitamin. Of course, I'm talking about vitamin E, but this is a bad idea to start vitamin E supplements, and here's why. Vitamin E deficiency is exceptionally rare, and it's only found in individuals with unusual health conditions. That's because it's found in a variety of foods, so for most of us, we're getting plenty of this vitamin from our diet. But the second reason is that vitamin E can interfere with the benefits from exercise if we're getting too much. This is a big problem since exercise is one of the most important contributors to overall health. Third, there's a disturbing possibility that supplementing with vitamin E could actually be shortening our lifespans instead of increasing it. An in-depth Cochrane analysis of clinical research looked at 78 trials with a total of almost 300,000 participants. They found no evidence to support antioxidant supplements to decrease mortality, and shockingly, the evidence that they looked at suggested that vitamin E might even increase mortality. That's the opposite of what we want. But on the other hand, it also appears that the form matters. So vitamin E comes in 8 forms, so 4 tocopherols and 4 tocotrienols, and it's the tocotrienols that appear to offer a greater antioxidant effect. So I've seen other creators on this platform ignore the safety concerns of vitamin E because they say that those studies didn't specifically look at tocotrienols. Now that's an interesting hypothesis, but it needs to be tested. We don't have any long-term safety data on tocotrienols, and besides, the tocopherols and the tocotrienols, they both act in roughly the same way. They're both antioxidants.